Hey guys, it's Bella. Welcome back to my channel, or welcome if you're new, and in today's video it's going to be a little bit of an uncomfortable topic for me personally. I'm going to talk about borderline personality disorder, so BPD, and how I cope with it, and what it looks like for me in my life. So first off, DBT impacts the way you think and process emotions and feel emotions. It makes emotions extremely intense. Yeah, it's actually quite difficult to live with. There is no cure, but it can be treated with medication along with a combination of therapy. Personally, in the past, I've tried CBT. That was the first therapy I ever tried. It did not work for me at all. And the thing I found that helped the most was DBT, which is not similar to CBT. It is quite the opposite, but I found it really helped for me. You do have to be, most of the time, above the age of 18 to actually get a BPD diagnosis. They generally don't like to diagnose in people that are younger unless they have, in certain situations, been exhibiting symptoms for a prolonged period of time, so usually over a year or two. The reason they don't like to diagnose it young is your brain is still developing, and yeah, I guess they just want to be sure, make sure your brain's fully developed before they diagnose it. I'm not too sure. Anyways, there are 9 traits to BPD. I'm just going to read them off my laptop really quick. Intense fear of abandonment, pattern of unstable, intense relationships, rapid changes in self-identity and self-image, periods of stress-related paranoia and loss of contact with reality, lasting a few minutes to a few hours, so for me that looked like dissociation. Impulsive and risky behaviors such as gambling, reckless driving, unsafe sex, spending sprees, binge eating, drug abuse, sabotaging success by suddenly quitting a good job or ending a positive relationship, suicidal threats or behaviors, self-injury, often in response to fear of separation or rejection, wide mood swings that can last from a few hours to a few days, ongoing feelings of emptiness, and inappropriate intense behavior such as frequently losing your temper, being sarcastic or bitter, or having physical fights. So yeah, it's not exactly fun to live with. I do exhibit most, if not all, of those traits, and I have been for quite a while now. I was just incredibly high functioning during the period of time I was going through school. I started to notice these onset of symptoms come grade 10. For me, I've been out of high school for about 2 years now, so I am now 19. I probably noticed those symptoms coming on when I was 14 or 15. But at first, the first thing I got was an anxiety diagnosis, and I tried some anxiety medication along with CBT, and I found that did not help me. And I was incredibly good at masking, and so I just looked like I was very high functioning, but in reality a lot was happening inside my head, and I would take out those emotions I've been holding in all day on myself at night. Yeah, so that was a very bad cycle that I was stuck in for a while. I actually didn't get a proper diagnosis or hadn't really looked into deeply what was going on until I was admitted to hospital for 3 months. They gave me my BPD diagnosis along with the proper medication and proper DBT treatment. That has improved my quality of life significantly. It is definitely possible to live a fulfilling life with BPD. It just takes a lot of effort on the daily, unfortunately. I actually said to my therapist the other day, I am scared because will I have to work this hard for the rest of my life just to feel normal or okay? And unfortunately, I probably will. So, on to coping strategies. So first off, before I was really deep into DBT, I kind of used a lot of attempts at self-soothing or distractions to deal with my emotions. That can come in the form of fidgets. I have an infinity cube here. Unfortunately, this does not do much when you are under periods of high stress and intense emotions and you lose your ability to think. This does not work. For anxiety or just general periods of where you feel distress coming on, it can be incredibly helpful just to distract yourself. I found I played with these a lot in therapy sessions because they were over Zoom for me, and I just needed something to decrease my anxiety and increase my focus, so that worked for me. Another form of distraction I like to use, bullet journaling. So for me, I am just starting my 2021 journal. I'm just getting through the month of January. This has been helping me a lot at night because my son goes to bed around 6 p.m. and then until about 11 p.m. I am alone. And it's the first time of day that I really stop everything and my thoughts just kind of sit in my head. And I tend to become very distressed around that time, so I like to do things to unwind, which is, for me, bullet journaling. Other form of distractions that I have found helpful, this is from DBT, but you can use distractions with your 5 senses. So distraction by smell, whether that be lighting a candle, spraying some perfume. It might sound like it might not work, but it helps in periods of anxiety, but not high distress. So these are skills you would use for moderate to low distress. So yeah, you can distract with sensations, temperatures, so whether that be a bath or a shower, or even just a walk outside. I know walking outside sounds like unappealing to most, but hey, whatever works. Yeah, I'm losing my train of thought here. I'm gonna move on to something else. One thing incredibly important for me was the first few weeks of DBT. So in that, you learn wise mind versus emotion mind. And that's important to many people because distinguishing the two really helps you to not only ground yourself, but to decipher between emotion mind and wise mind, emotion mind will trigger your impulsivity and you would lose your kind of thought process in that mindset. So they try to get you to go from emotion mind, which is up here, down to wise mind, where you can think properly and reflect. But yeah, I'm just gonna share crisis skills now because those were the most important for me. I just have them in my bullet journal. I have them in the front because I would like to refer back to them. The one that works ultimately the best for me is the tip skill. So it is, you can either tip the temperature of your body. So for me, the most effective way, you take ice cubes or a cold washcloth or something and under your eyes, kind of where your cheeks are. And I find the temperature shock to my body. It stops my thoughts temporarily and I just have a second to go blank and it decreases my crisis a little bit. The second one I don't really find works for me because I have struggled with eating and exercise in the past, but the second one is intense exercise for short periods of time. That's the iron tip. I find with exercise I just go too overboard and it makes me more anxious, so I tend to refrain from that, but if it helps for you, even just like 20 seconds of jumping jacks when you're incredibly stressed out and you can't think anymore, just helps get your heart rate up and then calm down after. The last one is paced breathing. This I find really helps for me. I also used to do something called square breathing, so I'm just going to take my little infinity cube here. I learned this in figure skating actually. So you would grab a rectangle or square, you would breathe in, and you would hold that breath in, and then breathe out, and just hold. And while you trace the square, you would just look at it. I used to trace bricks on the walls of the arena or of a school outside. And you would just keep doing that for a while. You would trace the square incredibly slowly while you breathe, and I just found it really helped to give you a second. Also, if you ever took singing or music, deep belly breathing I find also really helps. If you lay on your back on the floor and you breathe into your belly and don't fill up your chest, you just let the air rise and fall in your stomach. So yeah, that's pretty much it for tip. I find that the most effective skill. Although these are crisis skills, so these are meant to be used when your emotions are at 90 to 100% and you just need something to stop your thoughts immediately. So for me, this was a good intervention before something like self-injury would occur, so I would use the crisis skills when I was at the very, very end of my rope. And they're not meant to be used for everyday scenarios, so just use them when you see fit. The other skill is stop, which you just stop, take a step back, observe what's happening in the situation. You can do that through imagery, kind of imagining yourself outside of your body in the situation. For me, that would trigger dissociation, so it wouldn't work as well. But yeah, just observe the situation and then proceed mindfully. So that's getting back into your wise mind state. I just have a little list for when to use crisis survival skills, because these are technically your survival skills. So use these skills when you have intense pain that cannot be helped quickly. You want to act on your emotions, but it will only make things worse. When emotion mind threatens to overwhelm you and you need to stay skillful, use it when you are overwhelmed yet demands must be met, and use it when sensory is extreme and problems cannot be solved immediately. So that has been a great skill for me. I find it very useful. I don't use it all the time, but I use it most of the time. Then I have another little page for distract. Just kind of distraction with activities, with emotions, and with sensations. So obviously you can add to that. You can, with activities, I just have clean something, go for a walk, listen to music, take a bath, puzzle, art, bullet journal, self-care. So these are kind of distractions for when you are at a medium intensity or a low intensity of anxiety or emotion, and you just need something to get you out of that mindset or prevent you from escalating into a worse mindset. Yeah. So also something we learned at the beginning of DPT was how to name our emotions, because a lot of the time when I would feel emotions, I would not know what I was feeling, or I wouldn't be able to process that I'm feeling things for a reason, and that was what would cause me to act impulsively. And for me, that also looked like shutting down, so I would stop talking, I would go silent. Yeah, it basically made me a zombie. Yeah, so they teach you how to name your emotion, rate the intensity, describe the prompting event of that emotion. So for me, I would do this after I felt an intense emotion. So what prompted the emotion? What was my body language like when I felt this emotion? Check the facts. Why was I feeling this emotion? Were there other vulnerability factors? Did I not get enough sleep? Did I not eat enough? How would other people have interpreted my body language? Was I showing aggression? Was I something like that? And what were my actions and urges when I felt that emotion? So whether that be harmful, or was I shaking, or stuff like that. And then after effects. How did I feel after coming down from that emotion? Yeah, and I just have a little check box of different types of emotions. Just, it helps you to label them. Yeah. Another skill I like to use is called Cope Ahead. So this one was very important for me. when I had a stressful event, I knew I could plan for. So something I knew that was coming up, whether that be a job interview, having to ride on the city bus, having to call a doctor's office. So this skill basically helps you to plan ahead. It lets you decide what skills you're going to use if you do fall into crisis. It helps you prevent falling into crisis, and yeah. So the first thing to do is to describe the situations, name the emotions you might feel, and the actions that will likely interfere with you using your skills. So basically, things that could go wrong that would interfere with you from thinking mindfully. 2, decide what coping problem-solving skills you want to use in the situation. So whether that be distracting yourself, self-soothing, just wise mind, thinking about it. 3, imagine the situation as vividly as possible. So this is some imagery. Try to picture yourself in that situation, or even role play it with a friend, or role play it with yourself. Whatever works. 4, rehearse in your mind how you would cope effectively if you were to become triggered in said situation. 5, practice relaxation after rehearsing. This one is especially important because if I even thought about a situation, it would trigger an intense sense of anxiety. So if I didn't scale down after, I would dwell on it, and it would get higher and higher and higher until I ended up in a bad place. Just need a second. Unfortunately for me, I love making videos, but talking makes me incredibly anxious, and the lighting is starting to disappear. But yeah. Anyways, there's a lot of helpful things about DBT. So another thing I like to use is something called Dear Man. So this is kind of how to negotiate with someone to get what you want in a situation. So this is objective effectiveness. For me, this was important with setting boundaries with people. Sorry, I just got a text. Okay. Yeah, so first thing, describe the situation, stick to the facts, tell the person what you're reacting to. Second is express your feelings about the situation and your opinions about the situations. 3 is assert, ask for what you want or say no clearly. R is reinforce, explain the positive and negative effects. So basically, you're acting like a broken record there. M, be mindful, keep your focus on your goals, ignore any attacks from the person. So just kind of reinstating your argument or your point or your need for a certain boundary. A, appear confident, appear effective and competent. And N, negotiate. Be willing to give to get, or turn the tables on the person by simply saying, what would you do if you were in my situation? I find that skill helps quite a lot. But yeah, if you want to find a better handout of this, just look up Dear Man on, like, it's literally an acronym, Dear Man. Look it up on Google. I'm sure you could probably find the DBT handout. This one is for relationship effectiveness. So this is in a situation keeping and improving the relationship. So when a relationship is of value to you and you need to meet your needs and someone else's needs. So this is being fair, apologize, stick to your values, and be truthful. So this is fast. And then the last one, I lied. That's the wrong one. This is give. So this is be gentle, be interested, validate the other person's ideas and opinions, and go about your points in an easy manner. So that's kind of how to negotiate with people to get what you want and what they want, while keeping the relationship okay. I don't know what else to say that. And then the last one is self-respect effectiveness. So keeping or improving your self-respect, so when you need to get something or you need to set a boundary and the relationship doesn't matter as much, you just need to reinforce what you want. Be fair, apologies, stick to your values, and be truthful. But yeah, that's pretty much it for that. As for future videos, I can do a story time of what my inpatient stay was like in hospital if anyone is interested, because I know that can be a somewhat scary topic for people. Well, yeah, if you want to know anything else about BPD or how I live my life, just let me know, drop a comment below. And thanks for watching. See you guys later.